All right, guys, since we're right in the middle of interview season, I wanted to make a quick video here that can hopefully give y'all a little advice on the preparing for your CRNA school interviews and get you on the right track when you're starting to study for these. Okay, so this will be broken down into two parts. Your school interviews, typically they're going to be clinical based or emotional intelligence based. It seems like from my experience, every interview I did was mixed. I had most of mine were actually a little heavier on the clinical side, but I didn't have a single interview that was either strictly clinical or strictly emotional intelligence. But look around. If you know people that have interviewed at the school before, you can ask them around Facebook, wherever, Reddit, wherever you can find some information to see if your school tends to be more clinical or emotional intelligence or just leans to one side more. So definitely find out that information. That'll help you in your prep as well. But for the clinical side, there's the things here that we'll go into each one of these into more detail here in a second. But you're going to need to know a good amount of pharmacology. That's probably the biggest section, I would say. You're going to need to know ACLS, which drugs to use, be able to go through the pathways, stuff like that. Patient profiles, what that is, that's like being able to explain sepsis or heart failure or what a cabbage procedure. That kind of depends more on your unit, and we'll talk about that a little bit later. Dosage calc, pretty self-explanatory there, and then there's a handful of clinical topics that we'll cover that I'll say that I would definitely be familiar with going into your interview. As far as the emotional intelligence, we'll cover that later as well. But this is be a lot of tell me about a time when you blah 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 did something questions, ethical dilemma questions, your strengths, weaknesses, things like that. So we'll start with the clinical stuff because that is the main as far as content wise. So pharmacology, how you want to prepare for this, the must know drug classes and drugs you're going to want to know. Going to be your vasopressors, your sedatives, paralytics, inotropes, antiarrhythmics, vasodilators, and then any ACLS drug. So when you're preparing, you're studying, so for vasopressors, right, you're going to have to know levo, epi, neo, sedatives, you're going to want to know propofol, Precedex, and just keep going down the line. Pretty much any drug that you commonly see in the ICU is definitely fair game. So you're going to want to know all those as well. And how you study for these is you're going to want to know the receptor, how it works from them. So is it an agonist, an antagonist? What's the drug used for? So what is indication? What's the actual physiological effect of the drug? And then side effects, adverse effects to monitor for, and then dosing. They definitely will ask dosing questions. So you're going to want to have to make sure you have all that memorized there. So that's how I prepare going into pharmacology. As far as ACLS, you're just going to have to know the main pathways, right? So adult tachycardia with the pulse algorithm. There's obviously the cardiac arrest algorithm, and then bradycardia as well. What I would do is you can go onto the American Heart website. They have links to all these and good PDFs. You can go and I would study all those. And then for each pathway, you're definitely going to want to know which drugs are used and when to use them. So, epinephrine, atropine, whatever it may be, you're going to have to know, when that kind of applies, what dose to give as well is going to be important. So that's for ACLS. Now, for patient profiles, okay, so this is these interviews, you can somewhat kind of steer the interview if you're able to do it right. So this will kind of depend on which diseases that you are comfortable discussing. If I could give you one piece of advice for your CRNA school interview, that would be this here in the stars, that throughout, especially in this section, but even pharmacology or whatever it may be, you only really want to mention things that you're comfortable discussing in further detail, because when you bring something up, they are going to ask about it, and they're pretty much going to keep asking you questions until you have to tell them, like, hey, that I don't know anymore. That's all I know. I'd have to study it further. So, for this patient profile section, a lot of a very common question I got in every interview was basically it's some form of tell me about your favorite type of patient to take care of, or they might say what's your most common patient you take care of. So, obviously if they ask you what's your favorite type of patient to take care of and you've been in a cardiac unit the last 2 years, but you took care of a stroke patient one time, but you don't know anything about stroke, don't say stroke patient, because then they're going to start going into detail about, how to take care of them, what meds you're using, why you're using these meds, things of that nature. So here you really want to pick one that you are very comfortable discussing in detail and just go with that. A list of some common ones here like cardiogenic shock, sepsis, DKA, acute respiratory failure, and ARDS. Those some probably very common ones that people speak to. I would think everybody, whether you see it a lot or not, should know or want to be able to talk to sepsis and acute respiratory failure. Those are very commonly brought up. DKA has been brought up quite a few times as well. So there's some you should probably, everyone should know, but then if they give you the opportunity to pick, definitely pick one that you see a lot and you're very comfortable discussing not only the disease, but the medications, treatments, and things like that. Okay, dosage calc. So what it'll be, most likely you'll be given a pen and a piece of paper. You will not be given a calculator. So you're going to have to practice your mental math leading up to your interview here. Most of them are pretty basic. I kind of gave you a little example here, like the patient weighs blank pounds. You have an order to administer however many milligrams per kilogram, how many milligrams we administer. So here you would obviously have to do the conversion between pounds and kilograms, right? And then you're going to have to do the mental math of multiplying that out. So most are pretty basic like that. In my interviews, there were several that were a little more complicated that started to involve, you're diluting the medication. My advice here would be, if you don't get it at first, don't panic. I'm personally not the best at the mental math, like preparing for this. I struggle a little bit with this as well, especially when we got the more complicated ones. So don't panic, try to work it out. Not everyone gets these 100% right, I promise you. Okay, and then other clinical topics. So obviously there is almost an endless amount of stuff that they can ask you about. This is common things that were brought up in mine or that other people have told me they were asked about. Ventilator modes, so the difference between each mode, when to use the modes, settings, what they mean. The second bullet here, once again, this is really important. So any devices you use on your unit, so if you do a lot of CRT or balloon pumps, ECMO, whatever devices you use, you're going to want to be able to discuss those in detail, how they work, why you're using them, side effects to monitor for, things like that. And this just ties back into only mention stuff that you're comfortable discussing. If your unit doesn't take balloon pumps, but you've only maybe had to take a balloon one time, I wouldn't even bring that up because they're going to ask you about it. If you can't explain it into detail, it makes it look like you don't understand the patients you're the patients you're caring for. Okay, interpreting ABGs and making vent changes based on ABG results. That's a very common clinical area question they can give you. Non-invasive ventilation, so BiPAP, CPAP, high-flow nasal cannula, things like that. The oxyhemoglobin dissociation curve. Personally, I was never asked about this, but I know several people that have vents. This can be common, so knowing how to talk about that in a little bit of depth. And then obviously lab values. If they give you a scenario, they're probably not going to give you the normal reference range for whatever potassium or something. You're going to have all that kind of stuff memorized. And then a couple formulas you should definitely know, like calculating cardiac output, your MAP, your anion gap, especially if you're planning on bringing up DKA, make sure you know that, things of that nature. Okay, and then before we get into the emotional intelligence, I did want to let you know some helpful resources here. I will link a free PDF with 25 example questions in the description of the video, so you can check out down there. Obviously, there's endless questions they can ask you, but that can just kind of give you an idea of how they might word some of these questions or some other topics they may hit. Also, we have started a Facebook group. It's called CRNA School Interview Help. We're trying to grow that. We're trying to make that an active community where everyone can come in there and share resources, ask questions, whatever it may be. So if you have a Facebook, you can check that out. And then I do have some other study resources, some PDFs and stuff. You can check the link in my bio for access to those. Okay, and now for the emotional intelligence. So once again, make sure you do research on your school to know, how much emotional intelligence questions are you expecting versus how much clinical are you expecting. But big thing with emotional intelligence is you're going to have I put 5+, so a minimum of 5 stories that you can easily discuss and you're ready to talk about. You have them memorized in your head, and if ideally these stories can apply to maybe one or two scenarios each. These questions are going to ask you is going to be a lot of kind of like when you probably had your nursing school or your first nursing job interview. Tell me about a time you blah blah blah. So I put a couple common ones here. Maybe you had to deal with a difficult coworker, you had to question an order, or had to say no to a doctor, you faced any type of ethical dilemma, you went above and beyond, etc., etc. There's tons of stuff, obviously, that they could ask you here, different scenarios. But if you have a couple stories ready to go, then hopefully you're able to work through all those questions. Other ones that I've gotten at every single interview is, why do you want to be a CRNA? Why did you apply to this school? And basically, why should we pick you? So being able to answer that without, sounding arrogant, right? You want to sound humble still, being able to word that. So those are just some questions you're going to want to have your answer ready for. And then with the clinical stuff, you're just preparing for all that, studying all that material. That way you can basically talk them through any clinical scenario. So hopefully this video helps, gives you all a little idea of what to expect. If you have any questions, please let me know down below. And if you liked it, please like and subscribe.